Well, you're all welcome back to the Good Summit here at Trinity College in Dublin. This session will be a discussion on the implementation of the United Nations Sustainable Development Goals through media well-being, and I have a very eminent panel which I'd like to introduce to you. Roland Schatz is the founder and CEO of Media Tenor International, the research institute of Innovatio Verlags. He's a leading scholar in the field of media impact research, and his interests include media monitoring, organizational development, cultural management, and new methods in education. He's the founder and chief executive officer of Global Sustainability Index Institute, supporting the implementation of the 17 Sustainable Development Goals. Also with us is David John Kerr. He's the digital accessibility lead with We Can Access Limited and accessibility ambassador and disability rights advocate. We Can Access Limited is a mission-driven social enterprise who are UN SDG champions and partners. And joining us online is Dr. Bogdan Chiva-Gursia, collaborator at Harvard Global Health Institute and the T.H. Chan School of Public Health and NHS Clinical Entrepreneur Fellow, also the author of the international best-selling book, The Unofficial Guide to Getting into Medical School. And I'm not sure, not having read the book, exactly what that is. In Ireland, we call that a Chancellor's Guide to Medical School. You can take that as you wish, but it's great to have you online, Bogdan. Let's talk, first of all, to Roland. Roland, I want to go back with a little history, first of all, to the Sustainable Development Goals. When were they framed and by whom?
Well, the SDGs were framed by the member states of the United Nations, but they became a result of somebody else who we all know, and I think we all love, Kofi Annan. The wonderful Secretary General of the UN back in the 90s, who realized that the world is only aware of the UN in their shortcomings. You might recall Rwanda, you might recall some of the big crises, and Kofi recognized that we need to have purpose. We need to understand why we agreed to have the United Nations. And he came up with the Millennium Development Goals. He announced them late in 1999 at the beginning of the new millennium, 2000. 15 goals, but in the typical Kofi lingo, let's improve education, let's reduce poverty. Whereas then, in the middle of this aim to reach these 15 goals by 2015, the new Secretary General, Ban Ki-moon, said, so what are we going to do in 2016? And he enforced the member states to come up with ideas, and they said, yeah, we should have something. And this time Ban Ki-moon was very smart, and he said, okay, if you want something, you define it. And it's no longer us, the UN, announcing something, because we have now implementation power. It's the member states. So you do your job. So they had 6 years of negotiation and debate, but then in an historic moment of mankind on September 25, 2015, 193 heads of states stood up, and by standing up in New York at the General Assembly, they declared these 17 goals with the 169 very concrete targets. No longer let's reduce poverty, but SDG number 1 is zero poverty. No poverty. SDG 2, no hunger. That sounds a little different than what Kofi Annan said. But all these 193 heads of state said, this is our new compass. And again, for the first time in history, they linked this with a time stamp by saying, this will become a reality in Ireland by December 2030. As well as Angela Merkel said it for Germany, or the friends from Bangladesh, or from China, or for Russia.
Now, if each leader at the time committed to these goals, it's one thing to commit to the goals for your own country. I mean, developed countries have pretty much eliminated poverty. By definition, we are far wealthier than other countries. So the idea of community in the United Nations means that the rest of us who have got to give and help those who have not. So was that a commitment too, that they would share what they had?
I think that was a little bit of the misunderstanding, because if we read all these 17 SDGs, gender equality by December 2030 in Germany, good luck with that.
Really?
And Angela Merkel stood up, and I don't know what she drank, but she said this should become a reality like all the other 17. So my impression was they had this idea, yes, let's define these goals, and they are great for Africa, and we can help Africa, and we can help Asia, but this is not really of importance to us in Ireland or in Germany because we have reached this. And it took 5 years around this that we started to wake up and said, well, really, access to good education, what Gareth was talking about, an understanding of health, which is more than just selling drugs, but health and well-being. Where are we in Ireland when it comes to health and well-being? Where are we on access to education for everyone, which means not just that you can buy a book, but that you are capable of using your brain, everything what you have, long-time learning? Are we already there? Yes, there are other countries who are more behind, but it starts in our neighborhood, what you said earlier on, it's the local thing.
Yes, the local thing, that we only care about those that we can see. But going back to that idea, where you have a very divided world in terms of resources, did they all sign up just to fix their own countries, or did they did they sign up to a common goal that they would help all the other countries too, who might have aspirations for educational equality, but not the means to deliver it?
I think the common goal is less of the problem than the one making sure that there is nobody homeless in Dublin as of December 2030. When I go to Cambridge in UK and I take the train and I walk from the train station to the university, I'm shocked about the amount of human beings who are laying on the ground, and I have to more or less climb over them, because in the city of Cambridge, rich as I don't know how many other cities, they seem to feel okay with the fact that you have I don't know how many homeless. So it's as I said, it's the first time in mankind that we have agreed to these very concrete goals. It takes a little bit to understand what we have agreed on, but it's now on us, and that is the beauty of it. It's on us here around the table, and it's not just the Prime Minister who has to deliver, because as these 17 goals are diverse, he or she can't do it on their own. It takes us to make it happen.
Now, we will later on in our conversation talk about technology, but who's measuring how well we're all doing at the moment? Because suddenly the deadline will be upon us, 2030, not too many years away. And we're familiar in this country with, if you want to get political agreement, and we have a health program called Sláinte Care, which is aiming to give us universal health care by 2030. If you put the horizon far enough away, it means that everyone can agree, it's fine, it's over the horizon, we don't have to worry about it. We can have 2 elections in the meantime, and no one's going to suffer by virtue of their support for Sláinte Care. So I'm just wondering, are there any milestones along the way that we all have to tick in order to monitor how we're doing?
Yes, usually it is very easy to make fun of the United Nations, that it's just a talking club, they never get their things done, etc., etc. Having said that, when it comes to this very special point, I have to bow towards the wisdom of the member states. Defining these 17, putting it down into writing with a time tag, which was only 15 years. But then having the wisdom to say, well, we let all of the member states do whatever they feel like doing the first 5 years. And we only invite that we give those who are inspired by these 17 goals, we give them a platform in New York. So ever since then, for the first time in 2016, Finland, what a surprise, others came along, only 17 of the 193 countries came and presented what they had reached already in the first 12 months. Next year, in 2017, it was already 27 countries. Then it was 53 countries. So they presented to each other what they had achieved. This was cherry picking. We are good in SDG 3,
sure.
So let's talk about SDG 3. We hide SDG 4 or SDG 14. But now, as we reach 2020, we have now, and you can Google it, we have now even the European Parliament, which is doing the metrics on the 28 member states, now 27, in Europe. How are they progressing on SDG 1, on SDG 2, on SDG 3? And at the same time, we at the UN, we have as well academics and others who try to move towards a clear index, giving us transparency where we are. But Guterres, the current Secretary General, he now mandated our partner UN Habitat as well as UNDP to come up with clear metrics and agreed indices to be presented to the member states by 2023, and by 2024 they have to be agreed. And then we have 6 years to really do the rankings. Who is where, in which field, whether it is Bangladesh or Madagascar or Botswana, and you'll be surprised. Would you think that Botswana had already done their national budget along the SDGs in 2017? Ask your own government.
Yeah.
Is their budget along the SDGs? I don't think so.
Probably
but
not.
Botswana did it already in 2017.
Bogdan is remote from us, so he's at something of a disadvantage, but he's been listening closely to what Roland has been saying. Your observation of these admirable goals, but how achievable are they, do you think? And, lots of excuses are used all the time. I notice in our climate action program in Ireland, for example, we have a program up to 2030, but we're leaving the heavy lifting, 8.3% reductions to the last 5 years, and 4-point-something% reductions in the first 5 years. And that's the way politicians react. Try and do the easy stuff first.
Absolutely, and thank you so much. It's a pleasure to see you all, and a warm hi to all your listeners, virtual and in person as well. I hope my internet connection will stay good. It would be rather ironic that technology will let me down in a session when digitalization and digital technology implementation. But that's a very good thought and very good point. And I think one of the most important things that the pandemic has taught us is that leaving no one behind is perhaps one of the most important goals we should look at. And that's one of the core messages by the Sustainable Development Goals. And I think it's very important to anchor some of the messages, like you said, and not just chat about things, but rather anchor policy into implementation, both within the local community sector, primary care and secondary care as well. But I think more than ever, one of the most important things, which is one of the big points I will later share about technology, is around health inequalities. They have existed before, but I think in light of COVID-19, they have surfaced, and we've shed light on health inequalities more than ever. We've seen this within the hospital. Those who have had the poorest outcomes have been the ones who were most affected by social determinants of ill health, and where health inequalities were at the root of the problem within the community. So I think as we start talking about leaving no one behind, and as we start talking about digitalization, yes, we want to talk about innovation and adoption and diffusion of and spread of those innovative, perhaps online consultations or perhaps devices that our patients can use. But I think one of the biggest challenges for me, if we want we need to walk before we start running. And by that, I mean, we need to make sure we offer access to the right people. There's always a call for more funding. There's always a call for, more actions. But how do we make sure that those actions and that funding reach the people who truly need it? And there's something there around value-based care, but also around personalized, person-centered care, to make sure that the funding that is being issued and that these digital technologies reach the people who are most in need and who would benefit from them. And I think that's one of the most important points, access to people from all over the world.
When we talk about access to digital technologies, and even in this country, there's a report published yesterday about how bad our health information systems are in Ireland, that a pharmacist doesn't necessarily talk to a doctor doesn't necessarily talk to a hospital digitally. They all talk, sometimes by telephone, sometimes by letter, believe it or not, written in longhand. But even though we're a sophisticated digital society, our healthcare is nowhere as developed as it should be in the digital frame. So, we've got great ambitions to do all of that. Meanwhile, there are parts of the developing world where the water's not clean. I mean, the ambitions are different depending on where you live.
Absolutely, and the problems will be different based on location as well. And I think that's one of the core points you were mentioning earlier about leaving no one behind and making sure that we collaborate and not compete with one another across the world, and that we share some of those lessons that we learned earlier on. I think it's funny because there's a great quote that says that in the midst of every crisis lies the great opportunity, and I think that's what COVID-19 has provided to that rigid system that you just described in terms of the pharmacist talking to the doctor by a letter often, and the rigid system that we know we have built over the years, which has been very reluctant to embrace change in the digital world for different reasons. But I think there's been an absolute incredible progress over the past year or two that we've made in face of the crisis that we've faced, because we had to, I think. So there's been a huge increase in virtual consultations, for example. They've more than doubled pre and post the pandemic. And I think that is good, but also we must not forget about face-to-face conversations and consultations that will allow us to notice the subtleties in our patients and the red flags that they portray, which you will not be able to pick up in digital format as well. But there's also been an increase from all over the world, not just within the UK. There's a great report that if anyone has a chance to look at by a team at Imperial College London as part of the Institute of Global Health Innovation. And they looked at different countries across the world, and it's a wide range of them. But they've showed how before the pandemic and after, in this 2-year window, there's been a 62 increase in digital technology. And again, we're not talking about those sci-fi interventions. I think we're talking about simple things such as giving patients access to their own records and allowing them to make a choice as to what's most important to their care, to be involved in shared decision making, and again get to the root of what truly matters to them, as opposed
Bogdan,
to us making assumptions.
Do you have any theory as to why the medical professions were reluctant to embrace digital technology until the pandemic forced them to?
I think it's a big, rigid structure that it has to move all at once together and in sync. And I think there's a lot of reluctance around who does the commissioning and who is being commissioned to provide these IT opportunities. But we at the frontline saw it as a great opportunity to move forward in the face of pressure with whatever we found useful at the time. And I think because we knew we had patients at home who couldn't visit a hospital, and we had the huge backlog that was starting to form of patients who were not being seen, we had to come up with various ways of seeing them virtually and creating systems in which they could be kept healthy at home. A great example of that is the NHS at Home program that was launched in the community in England. And what they've done is they've sent pulse oximeters at home to patients who were most at risk, and try to work with them to help them understand what that does and how they can monitor their progress. And if it worsens, they then go into the hospital, but at least it then provides another triage, and it provides a bit of peace of mind for the patients as well. But I think the pressure from the pandemic has allowed us to push the barrier beyond seeing patients just face-to-face, there's a great argument about seeing those two. We can see, digitally, because sometimes it's just about issuing another prescription. Sometimes it's just about someone being worried that may just need a bit of reassurance. However, and I think this comes with a big but, not everything can be done virtual,
sure.
And face-to-face appointments are crucial to get to the root of the problem. And as I said, there's sometimes nuances and red flags that you will not be able to pick on digital technology.
David, you've been listening to all of that and talking about the technology and how it can make access, it can open up access to people who don't have access. And you can take it to maybe a backward part of the world where they don't have much in the way of communications, but everybody has something of a smartphone. And diagnostics by smartphone will suddenly open up a world of medicine to those who have been currently disenfranchised.
Absolutely, absolutely. And I mean, a key way of looking at this, like a real-life example over the last couple of years alone, is I specialise in accessibility in the workplace itself. So with everybody having had to work from home and obey that rule of not going into the office, the doors that opened for those with accessible needs who couldn't make it into the office, that was incredible. So looking at that in that context, in that real world example that we've had, if we could look at how and there are lots of apps and chatbots, like Bogdan mentioned, already there and available, just not at scale. But what that could represent, especially for the underrepresented parts of society, to give them that access, and then how that could lessen the burden somewhat on healthcare, which is already too much in demand and huge crisis. That could massively ease the burden there. So it's just a case of applying this at scale to the population.
Yeah. I mean, many people are embracing working from the home, whether they're able-bodied or not, and they enjoy it because the commute is not there, and childcare, all of these things may be easier. But for people who have had difficulty in the past, pre-pandemic, in accessing the office, the idea of consigning those people forever to work from home, where one of the vital ingredients of work is sociability, face-to-face sociability, not online sociability, not Zoom sociability, but real sociability. We probably have to be careful that we don't in some way diminish the quality of life of some.
Absolutely, absolutely. I mean, looking at it like when you say it like that, Pat, I mean, it was probably over a year ago when I sat back and thought, geez, I never thought I'd have said I missed that commute to work. But for me personally, I do. I miss that professional environment. There's lots of people who I work with who are happy, and maybe they live a bit further down the country, so they'll maybe come into the office a couple of times a month. I think it's different for everybody. Moving forward, there is going to be a huge hybrid environment, which has been enabled massively because of technology and also because the workplace has molded to work with that as well. I think what's important is that moving forward, like when we were all told to work from home and we had to adjust to that, like I'm working from my wife's makeup table in the bedroom, I had to adjust to that. But everybody in the world, never mind Ireland, everybody was in the same boat. So moving forward in this hybrid working environment, we're not all going to be in the same boat anymore. You're going to have people like myself loving going to the office, and then you're going to have people working from home. So we need to make commitments to keep the communication, just to keep the communication there and to keep everybody in that same boat in the workplace.
Now, when we've been talking about accessibility for all, in the developing world, in the developed world, to healthcare, sometimes because we advance so fast and there is the digital divide, we don't see the digital divide in our own countries. For example, this morning on my radio program, I had a communication from someone who said a particular form from the revenue commissioners is not available on paper anymore, and I am not computer literate. What do I do? And they were told, well, you can go into the local social services office and they'll do it for you there. But there was someone where progress for most of the population means a diminution in the service offered to a smaller cohort. Roland.
Well, we were this morning in this amazing institute here at Trinity College, where you have the experts on the research, how the brain is important, and how we need to be aware of what are the reasons for dementia and Parkinson and other things. And if you listen to these fantastic experts here just around the corner, more or less, and you learn that we can actually avoid getting dementia or Parkinson by doing certain things which seem almost like not only last century but last millennium, which is let's meet, let's sing together, let's read a book together. I think one of the fast achievements we can really do is that we bring the kindergartens and the primary schools really back into the senior citizen homes. When I was a little child, I wanted to become a concert pianist. So I had to perform in front of other people to get into this confidence, yes, I can play. What were we doing? We were playing at the senior citizen homes, but we were only allowed to do this a few days before Christmas. That was the traditional thing where you would go to the senior citizen home. Why were we not allowed to do this again in January or February or March? Now, this is the one-way point for young people who can grow into being in contact with senior citizens. Now imagine the senior citizens doing things together with the little ones, reading books, drawing paintings with them, helping them with their homework. This alone would reduce the cost of the national health system, I would guess by easily by 30 or 40% of the cost, but it would bring us back together where we have to be. We are in this together, and SDG 10, guess what, is inclusion,
it's
leaving nobody behind.
It's a two-way street, because the 12-year-old might well help grandmother with her tax return on the phone, on the laptop.
And helping the online stuff to fill the other things out which they can't do on their own.
Yeah. David, the question of these metaverses, you know, Google are now developing this thing, or is it Facebook? I think Facebook are developing this thing where you go into a world wearing your virtual headset and you can do everything. You shop in what appears to be a shop. You use some sort of coin, not Bitcoin, there'll be a Facebook coin to buy things and so on. So you have the illusion of sociability, but not the reality of sociability. I mean, that would appear to me to be a backward step, not a forward step. And yet that's what they're developing.
Yeah, I think, I mean, look, this is early days. Who knows where this will really take us? But I think like Bogdan touched on, we need to make sure all transformations that are happening are human-focused, human-centered transformations. So any tools that we can use, they are just that, they're tools. So this metaverse, it could be massively convenient. It could help us in many, many ways, especially in this day and age where who knows how far going forward we're going to be worried about social distancing, washing your hands every time you walk in and out of a place, masks, God knows what. So when it comes to doing your shopping, when it comes to wee bits and pieces like that, maybe this metaverse could be massively convenient for that. But I think it's so important moving forward that we have to keep the focus, like Roland has said, on communications, sitting down, having cups of tea, having coffee over the chat in the office, sending the children to speak with the older generation. So many things that we can't let slip.
Now, Bogdan, I know you were an advocate of a term I had not heard until today, social prescribing. Now, what is social prescribing?
Absolutely, and thank you for setting me up quite nicely, because I know I just wanted to say we are social beings, and we need to work like social beings, and we long for that human contact. So social prescribing, in simple terms, is a tool for everybody to use to support the biomedical approach to medicine. So it's complementing the biomedical sphere by providing psychological and social support, because we know many of our conversations and consultations will be for pure social or psychological reasons. So in simple terms, how it works is that anyone can refer or even self-refer themselves, or the clinician can make the referral to what we call a link worker or a community navigator. And this person within the community has access to a bit of a menu, just like in the restaurant. And they have a list of activities, and then they offer people and individuals, and I'm not going to say patients because they are individuals, offer them the greatest asset of all, something I rarely have in hospital, which is, as you probably think already, time. The link worker sits down to get to the root of what's important and what truly matters to that patient and that individual, and how to transform them from a patient to an individual to reach their goals and individual needs. And I think there's a big but in there. It's not signposting. It's not telling patients or individuals what to do. It's working together with them to co-design and co-collaborate and use shared decision-making to build a pathway for them. And I think there's something in there around how social prescribing, but also this mindset and cultural shift from the sick care model, where we just focus on disease, to moving to a place where health really starts in our homes, health really starts in our communities, and building that wider ecosystem within the community so that hairdressers, firefighters, policemen get some training, and they can support the general public, they can notice mental health, or they can also help with the spread of digital literacy and making sure that, again, nobody is being left behind.
Just to give me an example, I'm trying to get a handle on this. You go to the doctor and you have various ailments, and that doctor, he or she, prescribes a particular medication which might be appropriate, and then they feel that, you know, maybe your spirit is not good at the moment, and they say, we need to prescribe you some social medicine. What might that be in practical terms?
Absolutely. And let me just give you an example, which is a rather difficult patient I recall, who was on 9 different medications, a cocktail of antiemetics, analgesics, a series of Parkinson's medications as well, and she had fibromyalgia, chronic pain. And often the patients with chronic pain will come and see you quite often. This particular patient would come in every single week. I would see them either in A&E, or my colleagues would see them in primary care. So in primary care, they would come for 10 minutes every single week. And what would happen is, in primary care, we just don't have enough time sometimes to get the root of the problem, so that we would just try different pill combinations. And so she was started on several analgesic and pain medications to no success, really. And then what happened is, when she was linked with the link worker, so the doctor just said, look, I think we should just try and explore some other alternatives that could complement this. She was linked up with somebody within the community, and she used to do salsa dancing when she was young. So this patient just was referred to a salsa dancing class, and the link worker worked together with the individual to make sure she enjoys doing that, and that it reaches their ultimate goals of staying active and smoothing the Parkinsonian gait and everything, decreasing the medication that she was on. And what happened eventually was that she was paired up to a community group where she could do salsa dancing, meet other people, make friends, and we also then found out that loneliness and the lack of connection was actually one of the biggest problems. And that particular patient, just to put it in perspective, went from 9 medications to 4 medications. She stopped all the painkillers. She stopped the antiemetics because the antiemetics were prescribed for the side effects from the painkillers. And she also stopped coming in every other week. And funny enough, we also heard from them that it was the only exercise she was doing. Coming to the doctors, it was the only social interaction she was having, because she had no friends. Her husband sadly passed away. She had no siblings. So that interaction was the only human connection she was getting. So I can't really blame her for coming to see us.
It's very interesting, Roland, that expression that we all know well. It takes a village to raise a child. And that really captures what that woman, that patient, was missing. That the social interaction, the sense of community, because she'd become more and more isolated. So that communality which you referred to among the nations of the earth, that is kind of mimicking what we'd like to see in our own communities.
Yeah, this morning you were making the suggestion of why are we as a country donating to 20, 30, 40 countries? Why are we not picking one and we feel responsible? We have this with cities, we have the Twin City program. Why are we not doing this on a country level? Why is island not picking Botswana. And sitting down and say, okay, let's go step by step on SDG 1, where are you? How can we help on SDG 2, blah, blah, blah. That is how things work. You know, when I get all the time the question, you know, these 17 SDGs, it will never work till 2030. And then I share with them one single experience which I did. I was 10 when I crossed for the first time the border dividing West Germany from East Germany because I wanted to visit relatives. I was not aware what that meant because I was born in Bielefeld and the border was far, far, far away. But now all of a sudden, as a little one, you come to a place in your own country and you have this imagination, you are living in a free country, you are living in a democracy, and all of a sudden there's this border. There are soldiers with machine guns dividing you from my stepmother, asking, what do you have in this suitcase? And they were going for the books. They were not going for the bananas, which were as well in the suitcase. After this 1 week, which opened my eyes, I came back home and I told my father, who was editor-in-chief of a newspaper and who was not allowed to go with us, as journalists were on the index and couldn't go to East Germany. I went home and I told my father, this has to end. This is nonsense. And my father gave this typical response of every father, I think, in the world. Boy, you need to pick realistic goals. This wall will be there forever, and focus on something else. I focused on the wall. 14 years later, on November 9th, 1989, I was literally in East Berlin. I saw this wall coming down within 14 years. And the whole world had agreed this wall will never come down. Bogdan would still be where he was born, and he would never be in Harvard. So this happened within 14 years. If this is possible, why can't we reach the SDGs? It's only the wall we have in our heads which are making it complicated. And if we follow your advice, picking realistic goals, take care of your community, start in your own neighborhood, but then pick one country, or maybe
make sure
and
that
make sure
everyone
that the police
has clean
exchange
water.
the fireway, the fire brigades make an exchange, the school choirs start to make an exchange. You get this done, it's not complicated.
Yeah. David, does that idea appeal to you, that sense of community that maybe many of us have lost?
Massively, massively. And I mean, for especially when we talk about internationally, cross-country, a couple of years ago, you couldn't imagine doing something like that. That'd be a long, withdrawn process. But the technology's there. I mean, Bogdan's here with us. The technology's there nowadays. There's nothing stopping this. So whether it's what Gareth was saying at the World Health Innovation Summit or Roland with the UNGSII, it's just a case of changing the mindset that is there and how we approach salutary health and well-being. And I think especially a lot right now is around education of children. We have to change the mindsets of people that are here right now, and the technology is an enabler of that. But we don't have to change the mindsets of the children. We make sure they come up into the proper mindset, even if that's just starting them off chatting with the nannies and pappies in the care homes.
Yeah. I think what appeals to me about our conversation this afternoon is the idea of picking something that is doable. Because you can dream the impossible, and that was fine with the Berlin Wall, and then Helmut Kohl, with a little help from a back door from Hungary, where East Germans were escaping anyway to the West, and the system in East Germany, the system in the Eastern Bloc was collapsing anyway. But people did not dream, well, your dad didn't dream it, but you did dream it, and it happened. So perhaps we should dream the possible and have ambitions to make it happen, even in a modest way, if each country did it.
Just don't get distracted by the metaverse.
A final word from you, Bogdan.
I was just thinking of a great philosophy, but I think it's actually, there's a quote, with great power comes great responsibility, and I think it's actually from Spider-Man, so not really a philosopher, but it's really interesting how that quote really fits with this digital technology business, because I think what we need to do now is learn and map out what happened over the pandemic, this accelerated way in which we transformed the way we deliver care, learn what's worked, what's been just noise, and whether it's impacted positively on the patients that we've catered for or not. And then I think that it comes with a big but for me, which is access, digital access, is the biggest point that I just want to leave you with. I think we just need to make sure that happens. And David touched very nicely on the idea of mindset change and the future generation. Personally, I truly believe that long-term change will only happen if we change the mindset of the future generation of healthcare professionals, so that such technologies are within reach, not just from a resource perspective, but from a mindset perspective as well. And finally, I truly hope that social prescribing can act as a bit of a Trojan horse for the over-medicalized world, because we call it social prescribing, but as you know, all doctors tend to over-medicalize things. And so when we prescribe something else than just medicines and pills, I'm hoping it will just fight fire with fire and improve that sense of community, because after all, we love working in tribes evolutionary. So that would be my final thought.
Bogdan, thank you very much for joining us online, and Roland and David, thank you very much for joining us here at the Good Summit in Trinity College Dublin. Thank you all.